welcome to this edition of the Alpha Neuroanatomy series. We are glad to have all of you here present. We will start with a little introduction. So Wapres, Afan country representative for Cameroon. So when I call your name, you present yourself and which school you're from. So Lisa, over to you.
Hello everyone, I'm called Tachan Lisa Vladimir. I'm a fourth-year medical student at the University of Montaigne Bagante here in Cameroon. Thank you for receiving me.
All right, you're welcome. Okay, Mr. Kingo.
Hello everyone, sorry for the background noise. I'm Nathan Kengo, fourth-year medical student at the Faculty of Medicine and Biomedical Sciences of Garoua. I'm glad to be amongst you. Thank you.
Okay, it's a pleasure to have you. So without further ado, we'll start with the presentation. Okay, Lisa, over to you.
Thank you again. This is an Afan clinical neurophysiology series, and here we're going to be talking about the meninges, the cerebrospinal fluid, the blood-brain barrier, and cerebral blood flow. Here we have our plan, which includes the introduction, the generalities, descriptive anatomy, neurophysiology, conclusion, and we have our references. For as objectives, we're supposed to be able to identify different parts of the brain, know the biology, anatomy, and function of the meninges, the cerebrospinal fluid, blood-brain barrier, cerebral blood flow, and know their different functions. Okay, let's first talk about the meninges. We know that the brain is protected under the skull, and the cavity under which is protected is called the cranium, whereas the spinal cord is protected under the vertebral column. In all of these bony coverings, there are three protective membranes called the meninges. These meninges protect the brain and spinal cord. These three membranes called meninges are the dura mater, the arachnoid mater, and pia mater. The dura mater is the outermost tough non-vascular and fibrous membrane, and is attached to the inner side of the cranium. It is separated from the underlying arachnoid mater by the subdural space, and is filled with visceral fluid. The arachnoid mater is the middle thin and non-vascular layer of the connective tissue, having web-like appearance. Here you can see that the arachnoid space. And in this region there are a large number of fine filaments called arachnoid trabeculae, and is separated from the pia mater below by the narrow subarachnoid space filled with cerebrospinal fluid. Pia mater is the most innermost, delicate, highly vascular membrane which lies in close contact with the cerebrospinal fluid. Next, we're now going to take each part of the meninges. We're going to start with the dura mater. The name dura mater derives from the Latin word tough mother or hard mother, meaning literally thick mother of the brain, that is the matrix of the brain. It is the outermost thick membrane made of dense, irregular connective tissue. It surrounds and supports the dural sinuses and carries blood from the brain towards the heart. Cranial dura mater has two layers. That's the superficial layer called the lamellae or periosteal layer, and the deep layer called the meningeal layer. It's important to note that unlike the cranial dura mater, the spinal dura mater has only one layer known as the meningeal layer. The potential space between these two layers is known as the epidural space. We're going to now talk about the dura mater folds and reflections. Within some areas of the skull, the meningeal layer of the dura mater folds inwards as a dural reflection. These folds help to partition the brain and divide the cranial cavity into several compartments. The dura has four reflections of folding. The first is the tentorium cerebelli, which divides the cranial cavity into supratentorial and infratentorial compartments. It also covers the top of the cerebellum and supports the occipital lobe. In this image, you can see the tentorium cerebelli. It divides the cranial cavity into supratentorial and infratentorial compartments, and it covers the top of the cerebellum and supports the occipital lobes. Second is the falx cerebri. It is a large crescent-shaped fold projecting down into the longitudinal fissure, separating right and left cerebral hemispheres. Thirdly, we have the falx cerebelli. It is a vertical fold that lies inferior to the tentorium cerebelli and the posterior part of the posterior cranial fossa. It partially separates the cerebellar hemispheres. Fourth is the stellar diaphragm. It is the smallest dural fold. It is a circular sheet of dura suspended between the clinoid processes, forming a partial roof over the hypophyseal fossa. It covers the pituitary gland in the fossa and allows passage for the pituitary stalk. Next, we have the arachnoid matter. It is named after the Greek word arachne, meaning spider. Because of the fine spider web-like appearance of the delicate arachnoid fibers called the arachnoid trabeculae, which extend down into the subarachnoid space and attaches to the pia mater. See in this image, this is the arachnoid matter, and between the pia mater and the arachnoid matter, there is a subarachnoid space. Cerebrospinal fluid flows under the arachnoid in the subarachnoid space within a meshwork of trabeculae, which span between the arachnoid and the pia mater. The arachnoid matter makes the arachnoid villi, which has small protrusions to the dura mater in the venous sinuses of the brain, which allows the cerebrospinal fluid to exit the subarachnoid space and enter the bloodstream. Hold on, I'm having it. Okay. Unlike the dura mater, which receives a rich vascular supply from numerous arteries, the arachnoid matter and the pia mater are generally non-vascular. The arachnoid matter covering the brain is referred to as the arachnoid encephalo, and the arachnoid matter covering the spinal cord is called the arachnoid spinalis. The arachnoid and pia mater are sometimes considered as a single structure known as the leptomeninges, plural leptomeninges. Similarly, the dura in this situation is called the Pachymeninges. There are two subdivisions of arachnoid matter, which are the dorsal layer and the ventral layer. Pia mater in Latin meaning tender mother. It is the delicate inner layer of the meninges. Pia mater is a thin, translucent mesh-like meningeal envelope spanning nearly the entire surface of the brain, except openings between the ventricles, the median aperture, and the lateral aperture. It is a thin fibrous tissue that is permeable to water and small solids. The pia mater allows blood vessels to pass through and nourish the brain. This section of pia mater enveloping the brain is known. This section of pia mater enveloping the brain is known as the cranial pia mater. The spinal pia mater encloses the spinal cord. Now, for some clinical anatomy. Now, the meninges are often involved with cerebral pathology as they are a common site of intracranial bleeds and infections called meningitis. Let's first focus on the clinical anatomy, which is the intracranial hemorrhages or hematomas, specifically the extradural and subdural hematomas. The first clinical case we will discuss is an intracranial hemorrhage or hematoma. Now, hemorrhage means bleeding within the skull. Hematoma is a collection of blood within the skull as a result of hemorrhage. Because the cranial cavity is effectively a closed box, an intracranial hemorrhage often leads to a rapid increase in intracranial pressure. This is a medical emergency. Intracranial hematomas are most commonly caused by rupture of a blood vessel within the brain or as a result of trauma such as a fall, a knock on the head, or a car accident. There are two types of hematoma that involve the dura mater. The most superficial, called the meningeal layer. These are called the extradural or epidural hematomas. And then we also have the subdural hematomas. An extradural is also known as an epidural hematoma, which occurs when arterial blood accumulates between the skull and the periosteal layer of the dura. Epi means above, so epidural means above the dura mater. These are typically caused by an intracranial arterial bleed, such as rupture of the medial meningeal artery due to a head trauma. Extradural hematomas appear as a lens-shaped opacity on the CT scan. Here is an example of a typical presentation of a patient. Here we have an epidural hematoma, and here we have a subdural hematoma. As you can see, here we have an epidural hematoma. The typical presentation of a patient that has an extradural hematoma is trauma to the pterion, the weakest area of the skull. They can also get headaches and a fluctuating level of consciousness. So this typically occurs after a knock on the head, for example, while playing baseball or cricket in a young person, or following a fall in an old lady. On the other hand, a subdural hematoma is typically caused by intracranial, is typically caused by intracranial venous bleed, commonly due to damage of the cerebral veins. Sub means below, so subdural means below the dura mater. Blood is collected underneath the dura mater and above the arachnoid mater. On a CT scan such as this one here, a subdural hematoma appears as a crescent shape or banana shape opacity. A patient with a subdural hematoma may present with symptoms ranging from mild headache to weakness to seizures and severe neurological deficits. This pathology is more likely to occur in elderly or chronic alcohol-dependent patients due to brain atrophy, increasing the likelihood of vein rupturing. So importantly, the CT scan findings in someone with an extradural hematoma is a lemon-looking shape opacity, a lens-shaped opacity, whereas in a subdural hematoma, it's a crescent shape like a banana. The next clinical anatomy is a subarachnoid hemorrhage. A subarachnoid hemorrhage occurs when the blood vessels found in the subarachnoid space, that the vessels that supply the vein parenchyma itself, ruptures, and these are typically arteries. On a CT image, a subarachnoid hemorrhage appears as an area of hyperdensity or brightness, typically found around the circle of Willis, where where ruptures of the barrier aneurysms can occur. Here you can see a CT scan of a subarachnoid hemorrhage and the circle of Willis. Classic presentation of a subarachnoid hemorrhage is a severe acute headache at the back of the head. These are called thunderclap headaches. Other signs and symptoms include vomiting. One second, something just popped up. Okay. Other signs and symptoms include vomiting, confusion, neck stiffness, and reduced consciousness. Importantly, risk factors for a subarachnoid hemorrhage include being female, alcoholic, cocaine use, and autosomal dominant polycystic kidney disease. The final clinical anatomy that we'll discuss is meningitis. The word meningitis means inflammation of the meninges. Meningitis is most commonly viral or bacterial in origin, although fungal, parasitic, and non-infectious causes are possible. The most common causes of viral meningitis are enteroviruses and herpes simplex viruses, whereas the bacterial meningitis is commonly caused by pathogens such as Neisseria meningitis and Streptococcus pneumoniae. Initial symptoms of viral and bacterial meningitis are similar. The classic triad includes fever, headache, and neck stiffness. Photophobia, which is discomfort with bright light. Phonophobia, which is discomfort with loud noises. Altered mental state and seizures can also occur. However, meningitis is often more severe as it can more commonly result in septicemia, which is a life-threatening infection of the bloodstream. Serious complications of bacterial meningitis include brain damage, learning disabilities, or hearing loss, especially in children. Viral meningitis also typically occurs with confusion as well. So in summary, in this lecture, we talked about the distinct membranous coverings of the brain and spinal cord. We discussed the three layers of the meninges, the dura mater, the arachnoid mater, the pia mater, as well as their functions. We then discussed the clinical cases of an extradural, also known as an epidural hematoma, a subdural hematoma, a subarachnoid hemorrhage, and meningitis. And we talked about how each case will present clinically. We now move on to talk about the cerebrospinal fluid. The cerebrospinal fluid, commonly abbreviated CSF, is clear, colorless, and colorless and transparent fluid. It circulates through the cavity of the brain, subarachnoid space, and the central canal of the spinal cord, and it's a part of the extracellular fluid, abbreviated ECF. For the composition and properties of the cerebrospinal fluid, for the properties, we can see here, there is a volume of 130 to 150 milliliters, of which 30 to 40 milliliters is in the ventricular system, and the remaining is in the subarachnoid space. We have a rate of formation which is 0.2 to 0.3 milliliters per minute. We have a daily secretion of 500 to 550 milliliters. Pressure on average is in the lateral line position. We have like 130 millimeters and in the sitting position, we'll have up to 200. Specific gravity, it can go up to 1.05, and the reaction is mostly alkaline. CSF formation. It is formed by the choroid plexus, which is situated within the ventricles. The choroid plexus are a tuft of capillary projections, which are present inside ventricles and covered by pia mater and ependymal coverings. As for the mechanism of formation, it is formed by the process of secretion. It does not involve ultrafiltration or dialysis. It is energy dependent and an active transfer mechanism is involved in the secretion of the CSF. As for the circulation of CSF, once the CSF is formed, later it is circulated. Formation of CSF is in the lateral ventricles. From here, it will go to the foramen of Monroe, then the third ventricle. After that, the aqueduct of Silvius, then the fourth ventricle, then the foramen of Magenzi and Luschka, then the cisterna magna and cisterna lateralis, then it will enter the subarachnoid space. And from the subarachnoid space, it will enter into the cerebral hemisphere as well as the spinal cord. These are the steps through which the circulation of CSF has been occurring. As for the function of CSF, we can see here, these are just a few of the many functions. We have a function of protection. The CSF protects the brain from damage. Buffering of the also buffers the brain. In other words, the CSF acts to cushion a blow to the head and lessen the impact. It acts as buoyancy because the brain is immersed in fluid. The net weight of the brain is reduced from about 1,400 grams to about 50 grams. Therefore, pressure at the base of the brain is reduced. Excretion of waste products. The one-way flow of the CSF to the blood takes potentially harmful metabolites, drugs, and other substances away from the brain. That's just a few of the many functions. Next, we'll talk a bit about the blood cerebrospinal fluid barrier. It is a barrier between the blood and the cerebrospinal fluid. It exists in the choroid plexus, the site of formation and secretion of the cerebrospinal fluid. It is similar to a blood-brain barrier, and this barrier allows the movement of only those substances which are revered by the blood-brain barrier. So in this brain, so in the brain, there are two barriers, which is the blood-brain barrier, and the second is the blood-CSF barrier. Substances which can pass through the blood cerebrospinal fluid barrier, we have oxygen, carbon dioxide, water, minor acids, electrolytes, drugs such as L-dopa, thyroid, tetracyclines, and other lipid-soluble drugs. Substances that can't pass through the blood CSF barrier, these are the dangerous chemical agents, pathogens such as bacteria, drugs such as penicillin and catecholamines. Dopamines can also pass. Therefore, Parkinson's disease is treated with L-dopa instead of dopamine because L-dopa can't cause a blood CSF barrier. Bipigment also can't cause. Now we will cover the blood-brain barrier. Blood contains waste, antibodies, macrophages, toxins, neurotransmitters, and hormones that can affect the function of our neurons. And we need to make sure that we can control the composition of our cerebrospinal fluid and prevent these substances from triggering responses in neurons that were not commanded by the brain or incoming input. So we have this blood-brain barrier that is going to prevent this unwanted passage of material from our capillaries into our CSF. In a normal capillary, we have these pores through which material can pass. If it's small, through material can pass if it's small, or material can pass straight through the endothelial cell, which are these cells that make up our capillary wall. And substances can also be pumped in or out by specific carrier-mediated transport. Now, this allows a lot of material to move in and out of the capillary based on concentration gradients. But in our brain, we do not want it, we do not want that to happen. So the only time material is going to pass from our blood vessel into the CSF is if the material is lipid soluble, meaning that it can just pass through our plasma membrane, or if we intentionally want that substance in the CSF, we use carrier-mediated transport. We can also see that we have tight junctions between our endothelial cells to prevent material from leaking in between our endothelial cells. And then we also have glial cells in our brain that is going to be our astrocytes that create this perivascular fit to surround our blood vessel walls and prevent any unwanted movement of substances into or out of our blood. So generally, we say our blood-brain barrier is created by our astrocytes. Now, some material can get through these capillaries. Now some materials can get through these capillaries as permeable to water and glucose. So glucose is going to be a fuel for our neurons. Dissolved gases can move in and out of the capillaries with no problem, and lipid-soluble substances such as alcohol, caffeine, nicotine, and anesthetics can also move directly through all of those cell membranes to make it into the CSF. But generally, we consider our blood-brain barrier is a tight barrier created by tight junctions because our endothelial cells and this perivascular fit, because of our endothelial cells and the perivascular fit of our astrocytes. You can see in this picture over here that our astrocytes are completely surrounding that capillary. Our blood-brain barrier created by our astrocyte is not the only blood barrier that we see in our central nervous system. We already discussed our blood CSF barrier. Our blood cerebrospinal fluid barrier is created by the ependymal cells, which are going to regulate the movement of substances into and out of our CSF at our choroid plexus. Remember, our ependymal cells are going to create cerebrospinal fluid by monitoring and managing the transport of materials into or out of the blood. There are a few areas in our brain that lack a blood-brain barrier system. The first of this is going to be our hypothalamus, which is located right here in our brain. Our hypothalamus is going to be the link between our central nervous system and our autonomic function, as well as integrating the functions of the nervous system with the endocrine system. Next, we have our pituitary gland, which is a gland right here sitting inferior to our brain and connected to our hypothalamus via the infundibulum. So commands are going to begin in the hypothalamus and they are sent down to our pituitary gland, and then our pituitary gland is going to be a part of our endocrine system. Lastly, we have our pineal gland, which is located at the back of our epithalamus. And if you think about these three structures, the thing that they all have in common is that they release hormones into the bloodstream, and all of them are actually nervous tissues. In order for these areas to act as nervous tissues releasing hormones as part of our endocrine system, they need access to the bloodstream, push those hormones into the bloodstream. Furthermore, the hypothalamus is going to monitor many different things for our brain, including fluctuations in blood glucose, pH, osmolarity, and CO2 levels. And then the hypothalamus responds to those levels by secreting some hormones to carry out some complicated functions in homeostasis. Now, talking about the cerebral blood flow, let's first look at the cerebrum. So coming off, what used to be the internal carotid artery, we have the creation of a new vessel called the medial cerebral artery. But then notice how it divides underneath this lobe here. So this is the medial cerebral artery, and remember there's one on the other side too. And it heads out laterally. Now, what else serves the cerebellum? So the next thing that we have are the anterior cerebral arteries, and the anterior cerebral arteries supply blood to the inner parts of the frontal lobes. Alright, you can really see how the anterior cerebral artery supplies blood to the inside part of the frontal lobes. Now we have a medial cerebral and anterior cerebral. The thing we're missing is the posterior cerebral. So our posterior cerebral artery is right here, and then you can see that it divides deep above the cerebellum here. So we're almost done on the blood vessels of the cerebellum. The one thing I want to point out is that notice how the anterior cerebral arteries are connected by this little bridge here, and this bridge is called the anterior communicating artery. And notice how the medial cerebral artery and the posterior cerebral artery are joined by this bridging artery. And there's one on each side. And this is called a posterior communicating artery. So one thing that might become really apparent to you now is this artery that serves the cerebellum has taken on almost a ring shape. There's a really obvious circle here, and this is really important in terms of brain circulation. This circle is called the cerebral arterial circle, or the circle of Willis. And that's why and why is it really important? Well, just think about this. Let's say you get a little blockage in an internal carotid here on this side. Well, you can see the image. You can imagine that now we are restricting blood from up this internal carotid artery. Then blood can't enter the circle of Willis, and we can't enter the medial cerebral artery from the internal carotid anymore. But because we have this collateral circulation provided by the circle of Willis, where blood can go around the circle, blood can still come up from this internal carotid and get around the circle and go into the medial cerebral artery from the other side. And blood can still continue to come up these vertebral arteries and up the basilar artery and still perfuse or fill up the entire circle. And thus it really minimizes the chance of you having some brain injury due to lack of blood flow to a part of your brain, because there's this collateral circulation, the circle of Willis. It's really important. So those are the three major arteries of the cerebellum. That's the middle, the anterior, and the posterior cerebral arteries. I think we skipped this slide. Okay, this. So by now it's really clear that the brain is really metabolically active. So it's going to need a lot of fuel. It's going to need a lot of glucose and a lot of oxygen, and it gets that by having a really rich blood supply. So here's a sort of glimpse of the major arteries of the cerebrovascular system. So let me just reiterate that the image on the right over here, we're looking at the underside view. We're looking up from underneath at the brain and looking at the blood supply from underneath. So let me start by saying that all of the blood that gets to the brain is essentially coming from 4 major arteries initially. So you have got one here. So you have the right internal carotid artery, this on the right, and then you have you also got an internal carotid. These are two out of the 4 major arteries. Then you have this one here, which is a right vertebral artery, and then you also have the one on the left. And by the way, they're called left and right vertebral arteries because they run up either side of your spinal column. So within your vertebral bones, and the internal carotid, they run on sort of the anterior and on the front part of your neck. All right, so these are the four main arteries: the two vertebral arteries and the two internal carotid arteries, left and right of each. And actually, notice that the two vertebral arteries, they sort of come together. They come together and they form this one artery here that almost looks like a little centipede. And that artery is called the basilar artery. So we'll actually include that as one of our major vessels as well, the basilar. So I've always found that the easiest way to do so is to think about which artery serves the cerebrum, and which artery serves the cerebellum, and which artery serves the brainstem. Okay. So now let's look at the blood supply to the cerebellum. All right. So the main arteries of the cerebellum are the superior cerebellar. So they are actually coming off the basilar artery and wrapping backwards to reach the cerebellum. The next one is the anterior inferior cerebellar artery. That's coming up the basilar artery. You can just see how important this basilar artery is. And last, we have our posterior inferior cerebellar, and that one comes off the vertebral artery and serves the bottom bit of the cerebellum. So those are the three major arteries of the cerebellum. And finally, we have the brainstem. So we have the brainstem. We can use green for our theme. So for the brainstem, we have these branches that come off the basilar artery called the pontine branches. As a group, we just consider we consider them the pontine branches. And I call the pontine branches because they serve mainly the part of the brainstem called the pons. And here they're on the anterior view. Last, we have the anterior spinal artery. Okay, so the anterior spinal artery sort of runs between it. Actually, it is connected to both the vertebral artery and it runs down the spinal cord, in the front of the spinal cord. Here's the name anterior spinal artery. So the anterior spinal artery, even though it's called the spinal artery, it still supplies a bit of the brainstem. So all of this, everything I just showed you, these are the main blood vessels of the brain. And finally, we have the brainstem. So for the brainstem, we have these branches that come off the basilar artery called the pontine branches. And they're called we just mentioned they're called the pontine branches because they serve mainly the part of the brainstem called the pons. And here they are on the anterior view. Last, we have the anterior spinal artery we just talked about. Okay, so the anterior spinal artery runs between it actually, and it's connected to both the vertebral arteries and it runs down the spinal cord. That's the front of the spinal cord. Hence the name the anterior spinal artery. So the anterior spinal artery, even though it's called the spinal artery, it still supplies a bit of the brainstem. So all of these are still the main blood vessels of the brain. Thank you so much for listening.
Wow, thank you very much for that amazing presentation. In fact, I did not know that you were part of the brain that did not contain the blood-brain barrier. I just learned it in this presentation. That's the hypothalamus, the pituitary gland, and the pineal gland. They are not covered by the blood-brain barrier, right? Wow, so amazing. Yeah, so if anyone have a question, now is the time to ask. We have roughly 8 minutes left. Or you can just share what you learned from the presentation if you don't have a question.
Hello?
Yes, Kengo.
All right, thank you very much. I sincerely want to thank the presenter equally for such a presentation. I mean, it was just very smooth. And I mean, it was really flowing, I really appreciate that. That's really excellent. It's just that somewhere along the line, we were a little bit lost because you would say here, you would see the, but we don't actually see, she wasn't using the pointer. So that's why I tried to raise my hand at one point, but she was not really, let me see, she didn't really notice.
Okay, yeah, I saw when you raised your hand. But I think...
I was just trying to indicate so that she can maybe use the pointer always so that we can actually flow with her.
Okay, yeah. I think everything was displayed on the images, just that you had to be really keen to point it out.
Yeah. All right. I wanted to raise 2 points. Firstly, on the the initial presentation on the meninges. I read recently about the foot meninges, which has been discovered, SLYM. I don't know if you guys have equally read about that, but it's kind of subarachnoid, something of that sort, SLYM. I think it was reported in this 2023. I am certainly it's not yet in the textbooks and all the like, but I think for information, it would be good that we are up to date at that level.
Okay,
Wow,
thank you for
okay.
that. Yeah, I would also
Yeah.
like if you could share a link to the article you read so that we also have a glimpse of it.
All right, I will try to, but now
Yes.
I'm just probably going to share into the AFAN group.
Yeah, we'll be waiting.
All right, and then well, it's just kind of an addition on the CSF. I would have really loved if we had a review on the constituents. She spoke of the properties, but we really didn't have a glance on the constituents of the CSF in terms of maybe proteins, what is present, absent, and all the like. But it was really a beautiful presentation. I really appreciate. I think that's all what I have to say, but I actually learned a lot, Thank you.
All right. Okay, there's a question in the chat box from Ku Chedi. I hope I pronounced it well. He said, please, can you explain the arteries using the pointer because I was lost? Okay. It's coming back to the cerebral blood flow, the blood flow anatomy. So we have like 5 minutes left. I don't know if Lisa, you can go back to it, right?
Okay, I just hope we'll not get cut off.
Yeah.
Okay, as we're saying, I'm just going to try to say the main points. We mentioned that the brain is very metabolically active and having a really rich blood supply, and we can see a glimpse of the major arteries of the cerebrovascular system. So looking up from underneath the brain and looking at the blood supply from underneath, let me start by saying that all the blood that gets to the brain is essentially coming from our four major arteries initially. So we've got one right here, which I mentioned. Let me try to arrange my pointer. We have the internal carotid artery right here. And then this one is on this one, I think we have on each side, we have the internal carotid artery. That's on the right and the left. And then that's really two of the major arteries. And the next now you have the right and the left vertebral artery. That's we have the vertebral artery on each side, the right and the left. Because they run up on either side of the vertebral column. So that's within your vertebral bones. And the internal carotids, they run on sort of the anterior, on the front part of your neck. As you can see, I think this image here shows us the internal carotid. As you can see, it runs on, as we said, the internal part of our neck. So we have the right and we have the left. Same on this image, we have the right and we have the left. I think those are the four major arteries that we spoke about, and we also spoke about the another artery known as the basilar artery, which some textbooks consider also one of the major arteries. The basilar artery, which is like the vertebral arteries, when they join together up here, we have the new formation of the basilar artery, which is one of the arteries that some textbooks still name major. So some textbooks say there are five major arteries, some say there are four. So we can actually include the basilar as one of the major vessels. So I've actually found that is the easiest way to think about it. The artery that serves the cerebrum. Next, I think we just spoke about this. I think we should go now to blood supply of the cerebellum. Okay, so the main artery of the cerebellum we mentioned the superior cerebellar, right here, superior cerebellar artery right here. So these are one of the main, this is one of the main arteries, and it's coming off the basilar artery. I don't know if you can see that this is the basilar artery right here, and the superior cerebellar is one of the branches, it's one of the vessels that stem off of the basilar artery, and it wraps backwards to reach the cerebellum. The next one is the anterior inferior cerebellar artery, as you can see right here. The anterior cerebellar is also one of the branches of the basilar. So you can just see how important the basilar artery is. And the last one, we have the posterior inferior cerebellar artery right here. I hope everyone can see it. And that one comes off the vertebral artery and it serves the bottom bit the bottom bit of the cerebellum. That's underneath here. So those are the three major arches of the cerebellum. And finally, now we have the brainstem. The brainstem. Okay. So for the brainstem, we have these branches that come off the basilar arch known as the pontine branches. Pons just because they mainly supply the pons. So on this image, we said the main arteries are the pontine branches, and they're and as called the pontine because they mainly serve the part of the brainstem called the pons. And there on the anterior view, let me
Oh,
see if we can have.
okay. Chanlis, sorry, we have less than 40 seconds left. Yeah, I think
Oh my
your
God.
explanation was explicit, and it answered the question from our colleague, Cool Strady. Yeah. So without further ado, we have come to the end of the meeting. We thank everyone for attending, and we hope to see you next time. Yeah,
Thank
Lisa,
you.
thank you very much for your presentation. Okay, so next time.